Your itchy, oily scalp may not just be dandruff. It could be silently making your hair loss worse. If your scalp gets greasy by the afternoon, if you see flakes on your shoulders, if your head feels itchy after sweating, or if you keep scratching the same red spots again and again, this video is for you. Because today we are talking about seborrheic dermatitis, not just as a scalp problem, but as a vicious cycle that can damage the environment around your hair follicles. And if you already have male pattern hair loss, that cycle can become a much bigger problem. Let's break it down. Your scalp is not supposed to be sterile. There are bacteria, yeast, oil, sweat, dead skin cells, and immune cells all living together on your scalp. Usually, they are in balance. But when the weather changes, when you sweat more, when your scalp produces more oil, or when your skin barrier becomes irritated, that balance can break. And one of the main organisms involved in seborrheic dermatitis is a yeast called Malassezia. Malassezia loves oil, so when your scalp becomes oily, it is like giving that yeast an all-you-can-eat buffet. More oil means more yeast activity. More yeast activity means more irritation. More irritation means more redness, itching, flakes, and inflammation. And then comes the worst part. You scratch. Of course you do. It feels itchy. But scratching creates tiny wounds on the scalp. Those tiny wounds make the skin barrier even weaker. Now more microbes, oil, sweat, and inflammation can enter the skin. So the cycle becomes oil, yeast, inflammation, itching, scratching, more inflammation. That is the vicious cycle. Now here is where hair loss patients need to pay attention. In androgenetic alopecia or male pattern hair loss, the hair follicles gradually shrink. The hairs become thinner, weaker, and shorter. But the oil glands around the follicle may still remain active. So, in many patients, the hair is getting thinner, but the scalp still feels oily. That is a bad combination, because thinner hair gives less coverage, more oil stays visible on the scalp, and inflammation becomes easier to notice. This is why some patients say, "Doctor, my hair is falling out, but my scalp is still so greasy." That is very common. And when seborrheic dermatitis is added on top of genetic hair loss, the scalp can become a more stressful place for the follicle. To be clear, seborrheic dermatitis is not the same thing as male pattern baldness. It does not replace DHT, genetics, or hormones, but chronic inflammation can make the scalp environment worse. And when the environment around the follicle is irritated for months, hair shedding can increase, recovery can feel slower, and existing hair loss can look more aggressive. So no, dandruff does not mean you will go bald tomorrow. But ignoring severe scalp inflammation is not smart. Now let's talk about what you can actually do. Rule number 1. Do not do no shampoo if you have oily, itchy, flaky scalp. I know some people say shampoo is bad. Chemicals are bad, and water-only washing is more natural. But for seborrheic dermatitis, water alone usually does not remove enough oil, oxidized sebum, sweat, and scalp debris. And remember, oil is the food source. If you leave too much oil behind, the cycle continues. Rule number 2. Wash according to your scalp type, not internet rules. Some people only need to shampoo once a day. But if your scalp gets greasy by the afternoon, if your crown smells oily, or if your itching gets worse after sweating, washing twice a day can sometimes help. This does not mean scrubbing aggressively. It means removing oil gently and consistently. Rule number 3. Use your fingertips, not your nails. This is very important. Do not scratch your scalp while shampooing. Do not try to remove flakes with your nails. Use the soft part of your fingers and massage the scalp gently. You're not sanding a wooden table. You're cleaning living skin. Rule number 4. Dry your scalp completely. A lot of people wash their hair and then go to bed with a damp scalp. That is a mistake. A warm, wet scalp is a perfect environment for yeast and irritation. So after washing, gently towel dry first. Then use cool or mild warm air. If basic scalp care is not enough, then we use medicated shampoos. Common ingredients include ketoconazole, selenium sulfide, or zinc pyrithione, depending on the country and product. These are not magic hair growth shampoos. They are scalp treatment tools. Their job is to reduce yeast, oil-related irritation, flaking, and inflammation. Usually, you apply the shampoo to the scalp, leave it for a few minutes, then rinse. Do not just put it on and wash it off immediately. It needs contact time. But also, more is not always better. Using strong medicated shampoo every day for too long can make some scalps dry or irritated. For some people, maintenance once a week or every other week may be enough. For others, the plan needs to be adjusted. This is where diagnosis matters. Because not every flaky scalp is seborrheic dermatitis. It could be psoriasis. It could be eczema. It could be contact dermatitis from hair products. It could even be irritation from overusing treatments. So if your scalp is painful, bleeding, crusting, or not improving, do not keep guessing. See a doctor. Sometimes shampoo is not enough. If the scalp is very red, itchy, swollen, or has folliculitis, we may use anti-inflammatory scalp solutions. Sometimes topical steroids are used for a short period. When used correctly, they can calm inflammation very quickly, but they should not be abused. Long-term random use is not the goal. The goal is to control the flare, protect the skin barrier, and then move back to maintenance. If itching is severe, antihistamines may help reduce scratching. If there is secondary bacterial infection, antibiotics may be needed. And if there are thick crusts, wounds, or pus, that is not a simple dandruff problem anymore. That needs medical care. Now let's answer the big question. Can seborrheic dermatitis cause hair loss? Yes, it can contribute to shedding, especially when inflammation is severe, chronic, or combined with scratching and infection. But in most men, with progressive thinning, the main driver is still androgenetic alopecia. So the best strategy is not choosing between scalp care and hair loss treatment. The best strategy is both. Control the inflammation, reduce the oil and itching, protect the scalp barrier, and if you have genetic hair loss, treat that separately with evidence-based options like finasteride, dutasteride, minoxidil, or other treatments depending on your situation. Because hair grows best in a calm scalp, not a red, itchy, oily battlefield. So here's a simple summary. If your scalp is oily, itchy, flaky, and inflamed, do not ignore it. Do not scratch it. Do not sleep with a wet scalp. Do not rely on water-only washing. Use the right shampoo, dry your scalp properly, and get medical help if it keeps coming back. Because sometimes the problem is not just the hair, it is the environment your hair is trying to grow in.